We are here as Allied Health Professionals Alliance Leadership, and I'm the chairperson for the Alliance. My name is Patrick Dennis Alibu. We've come to remind you of the industrial action intended for 16th. That is coming following a notice that we made on the 25th of April over a number of issues, but most importantly on huge salary disparities that exist in the health sector based on what government promised to allot to the professionals. In that letter that we wrote on 25th and submitted to the Speaker of Parliament, we expected response from Parliament, and in this case the government leadership, to meet us and discuss with us ways on how we could have the issues of salary disparities addressed. But unfortunately, till today, we have not got any feedback. As allied health professionals in Uganda, it's not our interest to deny our citizens, our fellow brothers and sisters, parents in Uganda services, but because of the way we are being treated and because of the way we are ignored, we have no option but hold this industrial action. And these allied health professionals constitute 36 cadres, and the 36 cadres has various professionals in that lineup. One, we have the medical clinic officers who cut across in all levels of practice in the health sector. We have the laboratory department, we have the physiotherapists, we have the psychiatric clinic officers, we have got the medical records, among many others, that do this wonderful job in the health sector. In total in the country, we make up to about 60,000 professionals registered with the allied health, and it could be even more than that if we trace back the records that are available with allied health professionals. We see in the headlines that over 14 million Ugandans suffer mental illness. And you can imagine, part of probably this mental illness is contributed by the poor motivation of health workers. And among them probably could include the health workers. We've come from COVID. People are mentally affected. The economy is shooting every day. I mean, the prices are hiking. So, ladies and gentlemen, fellow countrymen in Uganda, let's ensure this is handled. All our professionals, Monday 16th, stay away from work. Thank you very much. For God and my country.
So we are appealing for government to come in. We know our president is a listening president, and this is have reached him. He has given directives, but people below him are not acting. This time, for us to send our message to the countrymen that we are dying, and our death is being caused by our colleagues. That's why we are calling for industrial action. And I appeal to all health assistants wherever you are, health inspectors wherever you are, environmental officers wherever you are, on Monday, come Monday, start home. Please start home. Industrial action starts on Monday until our issues are addressed by our government. I call upon countrymen and women to understand us. You know, difficult situations call for difficult responses. We are in a very difficult situation. Somebody say that a camel never refuses any load, but a misplaced string shall always make it rebel. We have allowed all this load, but it's too much. This time for action. Thank you very much. I remain M. Rimbaha, the President of Environmental Workers Association of Uganda, and we are in it together. We are over 10,000 registered both at all levels, the health assistants, health inspectors, and environmental health officers, registered by Allied Health Professional Council.
My name is Paul Chaterekera, a medical clinical officer, and I am the president of Medical Clinical Officers Profession in Uganda. So Ministry of Health has discriminated allied health professionals in this way. They are rejecting the schemes of services, telling the officers in the Allied Health Professions Council to remove the degrees so that now the schemes of services can proceed to the higher levels of approval, which we are saying no. We should allow all other. Actually, Ministry of Public Service has a professionalization policy where all health workers should be able to self-propagate, that you can move from certificate to diploma to degree to PhD to master's and PhD. That is what we call professionalization. So we should be allowed to progress. But now there is that systemic kind of discrimination that you shouldn't allow other cadres, especially the allied, to acquire a degree. And when their degrees and their schemes of services, you reject. This one is part of what is taking us to the industrial action, among other issues like salary. Then schemes of service is also very important. If this is not looked into according to us, in addition to the salary, us health workers are also health workers, especially clinical officers. We are very ready, and on Monday, because we wrote this letter, petition went to the Speaker of Parliament, and all these issues were put here clearly. So nothing has come out from there. So on Monday, we are going to lay down our tools as clinical officers in Uganda because of these very issues. In Uganda, clinical officers that are employed in government form about 25,000 clinical officers. So we are a very big workforce, and we serve from Center 3 up to national hospitals. So clinical officers are there. When we sit down, that starting Monday, I don't think this will be the best, but I think we are pressed to the wall. As part of the allied health professionals, we have to do this. Probably that's when government will listen and probably be able to talk about the people in the system that are oppressing and discriminating us as allied health professionals. Thank you very much. I remain Chaterekera Paul, the president of Clinical Officers Professionals, Uganda.
By names, I'm called Atibo Bernard. I'm the General Secretary for Buhio Medical Coders Association. This is an umbrella that brings together the medical records officers and health information officers across the country. We are proud to be part of this alliance because we belong to Allied Health Council, and our activities and our performance is also regulated by Allied Health Professional Council. Like my colleague, the chairperson for the alliance has talked a lot about the whole thing. I'm not going to repeat, but I'm just going to strictly talk about the issue of salary disparity. Currently, as a medical records officer, we earn 318,000. That is the basic pay. U7. It is U7. But we are saying we do not want this. We are not administrators. We are health workers. We want U7 medical, and we want that 1.3 million. And as medical records assistants and medical records officers countrywide, we are over 3,000. So I'm calling upon all these 3,000 officers to lay down their tools because their voices have not been heard.
I'm by the names of Alex Kachwano. I am the Secretary General of Medical Clinical Officers Professionals Uganda, and in the Alliance, I'm the Secretary. As our previous speakers have put it, Allied Health Professions, we contribute a lot to the health sector. Together with the nurses, we contribute 80% of the services that is delivered to the country. Specifically with allied health professionals, we are more so in the primary health care. This is the services that deals with prevention. Right from primary, people have been hearing prevention is better than cure. However, it has been turned the other way around with our government, that they prioritize curative medicine than the preventive medicine. So we call upon the government to see the priorities and the people that are well formed for that. Allied health professionals, medical clinic officers are taught in community health, environmental health professionals are taught to prevent, educate, and make sure that diseases don't to involve the community. Those are the principles that form public health. Not having one person attended to by a group of people in the theater. Thank you. I remain Alex Kachwano, Secretary General, Medical Clinic Officer Professionals Uganda, the Secretary of the Alliance, and I call upon all the professions and allied health professionals Alliance to comply come Monday. We are standing together for the first, if not the last, and I expect the government to hear our bid.
I'm Florence Alezuyo, Vice President, Psychiatric Clinical Officers Association. We treat mental illness, clients who have alcohol and drug-related issues, trauma. As you see, many people, vehicles and so on, are engaged in road traffic accidents, and after the accidents, we become very important in that area to give psychosocial support. We treat, we review, we refer patients who have mental illness and mental-related health problems. As my colleagues in the Allied Health Professionals Associations have said, it is a great moment in the life, in the history of allied health professionals, that we have come together to stand in and talk for ourselves. We have been represented by other health professionals. Whenever they talk of health workers, they think of nurses and doctors. Nobody thought of us. And the new vision that showed that 14 million people in Uganda have mental health related issues, and this 14 million is being treated by 500 psychiatric clinical officers. It's really very traumatizing, and at the end of the day, you'll find that the number will increase, because these health workers who are treating the 14 million without very little pay will end up being patients themselves. You cannot really go work, you come home and sleep hungry. You need your children to go to school. At the end of the day, we are going to have increased number. Depression has become the major mental illness in the country because of stress, because of the cost of living. You are earning little. You go to the same market with the ministers, with the MPs, with the doctors and everybody. But at the end of the day, you are sleeping hungry. Rent. Your children are home. You are renting out of the little money that the government gives you. Nobody considers you for housing allowance. It's really very traumatizing. Government should come up, listen to our voices. We are not here to make noise because we need money, but the cost of living is very high and we need to survive.